Now, a lot of committees, plans, and a price tag well over $1 trillion. And that adds up to the opening salvos of the health care debate fired in Washington. Lizzie O'Leary is here to walk us through what will be the most contentious legislative fight of the summer. Lizzie?
Absolutely, Matt. You've been talking about regulatory reform, but that doesn't get close to even being on the calendar for Congress until they get done with health care. And a lot of things have just fallen apart in the past couple of days. At this point, no one's really on the same page. You've got one group of senators. They've started to have public hearings. They're led by Chris Dodd and stepping in for the ailing Ted Kennedy. And basically what they want is a public insurance plan that would compete with private insurers. They also want to see subsidies for low-income Americans to buy coverage and some sort of mandate for employers to provide care. The problem here is that a preliminary budget report came out putting the price tag at just part of this plan at over $1 trillion, saying it would leave millions of people still uninsured. Well, that number spooked another group of senators, largely Democrats, on the Finance Committee. They've stalled. They haven't even put out a bill yet, though they're thinking about doing something that would essentially create private cooperatives, nonprofit cooperatives to compete with private insurers, as opposed to that public plan. That word's a little toxic up here. Then you've got Republicans objecting as well. So into this morass, really, stepped a bipartisan group of elder statesmen led by a bunch of different Senate Majority Leaders, Bob Dole and Tom Daschle, who was supposed to be this administration's health czar. They've got yet another plan that would tax some insurance premiums. And Daschle basically told us, look, the way to overcome this impasse is to get the solution, the cost part, paid for.
I think the biggest stumbling block is probably whether or not we can finance the first 10 years as we create the new infrastructure. $1 trillion is a large amount of money, but next to the $35 trillion we're going to spend in health care over the next 10 years, I think it has to be put in proper perspective. If we can get the financing right, if we can get the infrastructure right, we can get this job done.
So what Wall Street needs to watch here is the words that come from the White House. Right now, they're hanging back a little bit, letting all of this chaos on the Hill play out, but they haven't weighed in yet, Matt.
All right, Lizzie, thanks very much for that.